Hi Alex, this is Jim Parker. I'm going to go over your knee real quickly here. For the sake of time, I'm just going to focus on a few of the key slices here. This is your right knee, and this is the fibula, this is the tibia, this is the femur. This is the lateral meniscus. It looks good. I want you to note the nice smooth contour of this gray line. That's the articular cartilage. The black line is the cortical bone. Just keep that in mind when we switch over to your left knee. This is the meniscal cartilage. Posterior horn, anterior horn, lateral meniscus looks really good. Now as we move across the midline, this is the ACL here, PCL here, both look good. Moving over to the medial meniscus, anterior horn looks fine. Posterior horn looks good in morphology. However, there's a linear band of increased signal intensity extending to the inferior articular surface right there. Little tear of that posterior horn extending to the inferior articular surface. That's really the only thing I see abnormal with that right knee. We're going to switch over to the left knee. This just takes a second here. But now we're over on the left knee, and there's a few more problems over here. You can see you've had your ACL reconstructed here on the left knee. This is the ACL reconstruction. This is the PCL. That looks fine. This is the medial meniscus. That posterior horn of the medial meniscus, it has a truncated appearance right here. It looks like it's been chopped off, either torn or a surgeon has trimmed off that anterior edge. This is the articular cartilage of your medial meniscus. It looks good, looks fine there. Moving over to the lateral aspect of your left knee, however, look through here. This area is abnormal. The articular cartilage is thin and irregular. Remember what it looked like on the other side. The cortical bone is disrupted. It's irregular. It's kind of lumpy bumpy. These little bumps and lumps should not be there. There's some abnormal signal intensity in the subcortical bone here, and that may be from a little bit of bone bruise, and that's shown on another sequence that I'm not going to show here for the sake of time, and some DJD. Arthritis will cause this thinning of the articular cartilage and the irregular surface of the cortical bone. Other findings here: the lateral meniscus, posterior horn, also has a somewhat truncated appearance at its anterior aspect. Right here you can see it looks chopped off there. That's either torn or been trimmed by a orthopedic surgeon. The other thing we're going to see here is fluid. This fluid here is medial to the medial head of the gastrocnemius muscle. That's called a Baker's cyst or a popliteal cyst. It's very common. It's a sign of some internal derangement. It's not specific, but it probably goes along with having had the surgery and having the cartilage problems we're seeing involving the meniscal cartilage and the articular cartilage that we saw right along here. That's a quick summary and review of your right and left MRI of the knee. Hopefully you can overcome these problems and get back to cycling in some form, but hopefully going over these will help you better understand what's going on. Thanks. Bye-bye.